Hi, I'm Dr. Ansel Johnson, Clinical Director of Vision Salon Eye Care Associates, located in Blue Island, Illinois. And we are so excited and happy to introduce our new associate, Dr. Dana Shannon. And what we are also excited about is that she has taken on the task of being our Director of Myopia Management Services. So let me tell you a little bit about Dr. Shannon. Dr. Shannon actually grew up in the South Suburban Chicago area. She went to college, played Division I tennis. So she's Division I athlete, excelled academically, which is real tough to do. Went on to the University of Alabama, Birmingham School of Optometry, got her doctorate degree. And in her last year, she was actually one of my very first externs. So she rotated through our office, and I saw something special within her at that time. And so we just kind of kept in touch, and she went on to become the very first optometry resident at the University of Chicago Hospital. Excelled there, and we were able to reel her in and bring her on board as staff and director of myopia management services here at Vision Salon Eye Care Associates. So I'm going to let her tell you a little bit about myopia management because we are so excited to bring a life-changing service here for many of our pediatric patients. And I'll just let her continue on with that.
Well, thank you for the excellent introduction, Dr. Johnson. That was very nice of you to say those things. So again, my name is Dr. Dana Shannon. I'm very excited to offer the myopia management services or bring on the myopia management services here at Vision Salon. So just in general, let's talk about what myopia is. So myopia, another term for that is nearsightedness. So it just means that far away, it's harder to see, it's a little blurry, but up close you can still see okay. Now, with myopia, there is an epidemic of myopia occurring now. So in comparison to maybe the 1980s, 1990s, there is about a double it's a double increase in people who have myopia, and that's worldwide. So they're predicting by the year 2050 that half of the world will be myopic.
That's where they wear those
number.
thick glasses, right? Where those you're thicker and the edges on the lenses are real thick.
Yes,
that's
heavy glasses. Right. I mean, heavy glasses, and just if you imagine trying to play sports with nearsightedness or swim, it's very difficult. So what we're offering here at the service that we're offering here is new. It's a novel service, and it's a way to slow the progression of myopia. So many adults out there that you all know, if you're nearsighted, you know that each year when you were growing up, your glasses got thicker and thicker and thicker. Your prescription just kept changing, and nothing that you could do about it. Probably felt helpless about it. Now there's a way that we can treat it. But let's first talk about myopia. Myopia is caused by the eye being too long. If the eye is continuing to grow, there is a higher risk of something called myopic macular degeneration, which is a permanent, later on in life, which is a permanent condition that causes visual impairment. The other issue is that myopia can also affect, school performance for children and also sports performance. So how are we tackling this epidemic, and how are we helping our children? Well, there are 3 different options. So the first which came out in 2019, is the MySight one-day contact lens. So the MySight lens is just as simple as a regular contact lens. You put it on and you wear it throughout the day. They take it out at night, and then they throw it out and they open up a new one the next day. What's great about the MySight lens is that the studies have been performed in children 8 to 12 years old. So this lens is not only safe, the lens is not a regular contact lens. It's actually safe for children to wear. And I've seen children at least at the age of 6 that were able to wear this contact lens.
6 years old, wow.
Yes.
Okay.
The second option is something called orthokeratology. Orthokeratology is beautiful. It's sort of like magic, because you are just wearing the contact lens overnight, and it's taken out in the morning, and you're allowed to have clear vision without the dependence of a contact lens or glasses throughout the day. So here at Vision Salon, we are fitting the Johnson & Johnson Ability contact lens and also the Paragon CRT, which are both FDA approved. So these are great options because myopia, studies have been shown that myopia can be slowed up to at least 80% in some cases, depending on which modality you use. Now, the third option is at low dose atropine. Atropine is a sort of like a dilation drop in the higher concentrations. So in our clinic for adults, some people may come in with inflammation or different reasons. We use atropine. However, in low dose atropine, we use it in comparison to 1%. It's a 0.05%, very, very low concentration for children, which is shown to slow the rate of myopia. And actually studies have shown that children haven't really had haven't had many adverse side effects, possibly light sensitivity, possibly blurry up close, but not nearly as much as with dilation. This is why atropine is recommended for children that are more younger, that would be less bothered. So,
and they can't put a contact in their eye. So,
yes.
Wow. I know we're running a little short on time, but we want to give you guys some information because we are so excited about this new service. And if you're interested, please call our office at 708-385-0013. You can see me, but if you're interested in myopia management, see our myopia management director, Dr. Dana Shannon, and she'll be happy to see you on your regular wellness or vision exam. And then she can tell you if your child's a good candidate. Now, as a parent, you know if you have suffered through your eyeglasses getting worse and stronger every year, and now your prescription is very, very strong, and you can't do anything without contacts or glasses, or you may have had to have LASIK, and you want to kind of save your child from this, you really need to give us a call and set that up. We can give you an idea of the cost, consultation, all of that. It's really not an insurance covered option, but think of it like braces for your child. It's more or less out of pocket in a lot of cases, but a lot of times your medical spending account, there are different finance programs that can utilize that to help defer the cost, reduce the cost to next to nothing for you. So give us a call at 708-385-0013. Check us out on the web, www.visionsalon.com. And again, this can be life-changing for your child. So any parting words?
No, that is all. Just give us a call and we'll be able to help out with your vision needs and especially myopia management.
All right. Be well, see well, be blessed.
Take care.
Bye-bye.